Hi, I'm Dr. Pejbadi. I'm a board-certified physician, and I'm the medical director here at Cellaxys. This video is to compare the benefits and the outcomes of surgical procedures versus regenerative medicine and stem cell procedures. Usually and historically, surgical procedures have been the status quo for most of our orthopedic injuries, and now orthobiologics, which is stem cell therapies, have come into play. Surgical interventions are obviously very aggressive. They have significant downtimes, and 25% of surgical procedures end up having additional surgeries or sequelae of the surgery that is prolonged, versus what we do at Cellaxys or other regenerative centers. The outcomes are significantly different. Downtime is significantly less. For example, our spine procedures that we do here, patients are down maybe 5, 6, 7 days at the most. Surgical procedure on the spine, patients are usually out for 6 to 8 weeks with minimal activity and with slow progression that could last up to a year. Our joints, total knee replacement versus adipose tissue of the knees, also have a significant array and changes on the spectrum. On the surgical side, you're looking at a 3 to 9 month recovery on a total knee replacement versus full recovery within 6 weeks and back to normal activity within 7 days for our stem cell and regenerative procedures. Usually, days lost at work with regenerative medicine is 0 to 4, depending on the procedure. The work days lost surgically is 2 weeks to 2 months on work loss. The hospital stay on surgical procedures on knees are about a day and a half or 2. Spines are 3 to 4. We have here at Cellaxys 0 downtime. You're in and out within 2 hours. Your bed rest is usually 2 days. One of the major cons that I like to talk to my patients are about the timing of total joint replacement. Shoulder, knees. We have a lot of knees that come in, and patients that are in their 50s, 60s, nowadays even 70s, considered young. And when you have a total knee replacement with a replacement joint lasting anywhere from 15 to 20 years, the main issue, and one of the things that I see over and over again, is that a patient who gets their total knee procedure at 65, now they're 80 or 85 years old, they're in good health, but they have a knee that is no longer working properly, the prosthesis is not working well, and they need a revision of the total knee, and nobody wants to touch an 85-year-old to replace their knees because of the possible poor outcomes. So that patient who's otherwise healthy ends up bedridden or in a wheelchair because of that one-on-one issue. And that's where I really aggressively promote stem cell procedures, that it could be a life-changing experience, that if you could delay surgery for 10 or 15 years, but in a worst case scenario, you can delay the surgery for years down the come, it allows you to have one total knee replacement in your lifetime without having the issues of being bedridden. Some of the pros of surgery is that there are patients that we can't help. We can't help everybody. It's very, very important for us to pick the right candidate to make sure we have the best outcomes. If someone has no cartilage and their knees, a lot of patients come to me and say, I'm bone on bone, but really they're not. So that's a very commonly used term. But if you really have no cartilage, you need to have a total knee replacement, total shoulder replacement, total hip replacement, And that's where surgery is important. And the right patients need to be sent to surgery. And the patients that have the ability to regenerate and recoup that joint should do stem cell therapy. The cost for surgery versus stem cell therapy, I believe that they come out to be the same. The stem cell therapies is usually an immediate out-of-pocket cost for X number of dollars. But when you have a spine surgery or a knee surgery, by the time you pay your co-pays and your hospital stay payments and your physical therapy co-pays and all that added together, it usually comes pretty close to what you would have paid for your stem cell therapy. So cost-wise, they're pretty equivalent by the time you get done with your overall expenditures on the surgery, anesthesia, hospital stay, downtime from work, and other costs, medication costs, etc. It really comes out to be the same.